So yeah, I will be talking about one of the examples that actually was just mentioned by Slava as well. So it belongs to the aspect that working together, WHO with other international organizations and national partners. So now I need just to figure out how this works. Does it? Okay, good. So we are a fairly young WHO collaborating center, as we were designated just in March 2021. However, we have been working already in the region for some while. And the core team of the center is the unit for HIV/AIDS, STIs and bloodborne infections. It is, however, also involving technical competences from immunization unit, from laboratory and global health sector. And today there are two other colleagues from the center or working on the activities of the center today here. So it's Michael Brandl that was presenting already earlier today, and Ida Sperle-Heupel. So you're welcome also to approach them if you have any questions afterwards. Yeah. Okay, so the activities of the WHO Collaborating Center are largely driven by the needs expressed by the countries and WHO request. So now we go to next slide, please. And with two core areas of activities, assisting WHO in supporting member states in developing methodology, planning, conducting and analyzing epidemiological surveys on hepatitis B and C and HIV in different population groups. And second, supporting WHO in assessing viral hepatitis B and C and HIV/AIDS monitoring, control and elimination in the countries of the region. So we have been already supporting several activities. So for example, hepatitis B serosurveys among children in 4 countries, adapting of hepatitis B and C testing in protocols that have been developed for SARS-CoV-2 surveys, for example, either looking more at the methodology or assisting with analysis of data. We have been also involved in IB-based strengthening in the European region, the Co-Impact Hepatitis project that was earlier today presented by Michael Brandl. And we have been also conducting the HIV program reviews together with WHO. And another project just coming as next is a Scale-Up HIV-HEP project, and I will say a couple of words on a couple of these activities in the following slides. But just before I go to the next slide, it's also important to say, so we provide this technical expertise where needed, and this can be informed just of our advice in form of a training, but also in a form of really going to the country with resources and helping hand by hand carrying out projects and research activities, for example. Next slide, please. A SeroB project is on preparation of serosurveys to evaluate hepatitis B vaccination impact in Eastern Europe and Central Asia. And we have been so far supporting 4 countries. And so it's Belarus, Turkmenistan, Kyrgyzstan and Moldova. And then, for example, in Moldova, the study is already conducted, the results are there. And Moldova has already actually received the validation for reaching the hepatitis B control targets. So and this serosurvey has been one of the puzzle tiles for this evidence. And results from Kyrgyzstan are now in data analysis stage, and from Turkmenistan, so the data entry is now currently taking place. And so the technical advice that is available is starting from protocol development, sampling methodology, questionnaires and all the study documentation, laboratory testing methods, and then including study implementation and data analysis. So far we have been more advising on the methodology and analysis of the data, and the countries have been conducting the studies actually themselves. And with this sort of support, and we always provide really support in a way that we explain how the sampling works, so the country can perform the sampling themselves on already establish sampling forms, for example, and like this we achieve also a capacity raising in the country. So ideally, after the project, the country could be able to conduct a similar survey themselves, for example. Now go to the next slide. Yeah, and the project, so I'm a bit lost with the slides, I'm sorry. Yes, now that's the correct one. So in a capacity of WHO-CC, we were also involved in an activity led by WHO, looking at mapping of all IB-based studies in the region and selecting the priority countries and priority areas that should be covered for example, in the next phase. And we are now also in the process of understanding which countries need more support, for example, that can be utilized in the coming years. So if there is a need in the countries, please do approach us. And we go to the next slide. And the co-impact hepatitis project has been already presented by my colleague, as I already have said. That's why I will not go into many details. But one aspect that we saw is that in many cases in the countries, that activities or efforts for viral hepatitis and HIV work can actually be joined. And in many countries, the already existing strong AIDS programs can be used to accelerate also hepatitis work. And as already mentioned, in October this year, there was a joint evaluation workshop. Can you please click? And that took place in Berlin. That brought together key stakeholders from participating countries, from Ukraine, Kyrgyzstan, Uzbekistan, and Armenia, to share experiences across borders and also to see how the ambiguous targets of the elimination can be achieved. And in an interactive workshop, we also discussed which targets are the most important ones, most hard or easy to reach, and most realistic to reach. And as well, what resources are needed for that. And here is just one example of one of the final, so to say, outputs of this process. And we saw with the question how realistic is to achieve the WHO 2030 targets. We saw that most realistic appears from these countries to be achieved the hepatitis B vaccination among children, blood safety, then followed by the prevention of hepatitis B mother-to-child transmission, diagnosis, safe injections, and most hard to reach was the reduction of incidence and mortality. Now we can go to next slide. So these were just a couple of examples of activities. And what's coming next? So there is a continuation of the co-impact hepatitis project. Now it's named Scale Up HIV-HEP. So we are again working with the countries in the Eastern Europe and Central Asian region. And the aim is to scale up the monitoring, control and elimination of HIV/AIDS and viral hepatitis. It's starting next month and will be 3 years long. And we have 4 different work packages. So we will be conducting desk reviews of HIV and viral hepatitis program data, so depending on the country needs. We will be particularly working also more closely with Kyrgyzstan, providing a technical support of the new HIV and viral hepatitis elimination activities. And it's really nice to see also IBEC here today in the room, as we have now met a couple of times during the last project. And we will be looking also at burden of disease estimations of viral hepatitis B and C, depending also in countries where it's needed. And we will be preparing a work package that we hope to start in 2024 on behavioral science. And also not on the slide, but because it's just still in the preparation and we don't know if it's accepted yet. So there is a plan to implement the EMIS, it's an electronic European MSM internet survey in the countries of Eastern Europe and Central Asia. So we hope that we will be lucky in that next year we can also implement this activity. And if you go to next slide. So what are the collaborating possibilities? So either within the terms of references of the WHO Collaborating Center or in a part of one of the projects, or if countries are interested in particular topics, please do approach us. We can jointly develop a new projects and joint activities and see how can we bring more technical and more financial resources into the region. And next slide is already the thank you slide. And if I remember the last slide from the previous presentation correctly, I believe we have reached already the success stage of the working together, but of course also it can be always more success. Thank you.